Sarah, I'm going to be your physical therapist for the day. Can I have you confirm your name and date of birth, please?
Summer Solovich, 8/11/1968.
Alright, nice to meet you, Summer. So what brings you in today?
I want to work on my left arm and my walking. My walking's giving me trouble.
Okay, so can you tell me a little bit about what caused this?
So 23 years ago I was cycling and I got hit by a van and had what they call a traumatic brain injury.
Okay.
So that's what I've been dealing with for the past 23 years.
Alright, well, I'm going to try to help you out with that, okay?
Okay.
Can you tell me any more of your past medical history?
That's
Anything
really the only thing. I've been healthy other than that.
Okay, well that's good. Are you on any medication?
I just started on baclofen to see if it can help with this arm.
Spasticity. Okay. And then what kinds of things do you like to do for fun?
Well, I used to love to play cards and basketball, but I haven't even tried to do that since. But I don't really do that anymore.
Okay. And then can you tell me a little bit about like your house, your living environment? Do you live with anybody?
I live in a 2-story home with both my parents.
With your parents? Okay. And then is your room on the top floor, bottom floor?
The bottom floor.
Bottom floor? Okay, so you don't really have to climb the stairs too often?
No.
Okay, good. Alright, so next what we're going to do is I'm going to take some vitals, okay?
Alright.
So first I'm going to take your blood pressure. I'm going to take it on this arm.
Okay.
Move some stuff out of the way. A little closer. Okay. Sorry.
It's okay.
Alright. I'm going to feel for a pulse right here, okay? There it is. Do you mind if I lift this up a little bit? Alright. Okay. Never mind. Okay. Alright. Alright. What was it? It was 130/82. Sound about normal?
Yeah,
What you
that's my
normally get?
normal.
Alright. So, now what I'm going to do is I'm going to take your heart rate. I'm going to put this on your finger and it's going to tell me your heart rate and just your oxygen levels, okay?
Cool.
Alright. Okay. So, next what I'm going to do is, I just kind of want to see what, how your arms are moving, okay? Can I have you lift your shoulders a little bit? Okay. Can I have you bring your arms out in front of you? Okay. And then can you bring it out this way? Alright, good. You can relax. Okay. And now what I'm going to do is test your sensation, okay? So I'm just going to do small swipes like this on different places, and I want you to tell me if you feel it, so say yes or no, okay? And I'm going to have you close your eyes, alright?
Okay.
Ready?
Yes. 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 Yes.
Alright. And then, next what I'm going to do is I'm going to test your balance, okay?
Alright.
But for that, I'm going to go ahead and put this on you. Just make sure we're all safe. It's called a gate belt. So this is just for safety so that I can hold on to you just in case I need to, okay?
Alright.
You're going to lift your arms up for me. Good. Okay. You want to get it nice and snug. Tell me if it's too tight though, okay? Does that feel okay? Alright. So first what I'm going to have you do is stand up out of the chair.
Alright.
Whenever you're ready. Good. Alright, now I'm just going to have you stand there. Alright, can you close your eyes for me? Okay, good. Now can you bring your right foot in front of your left foot? Good. A little difficult. Alright, and you can bring your feet back right next to each other. And then I have you stand on your right foot, just your right foot. Okay, good. Now can I have you stand on just your left foot? And this is here if you need it. If you need to touch, that's fine. Alright, that's good. You can go ahead and sit back down. Alright, so now what I'm going to do is I'm going to do some different tests, checking your coordination, some of your movements, and your strength and stuff like that, okay?
Alright.
Alright, so the first one we're going to do is going to be testing your coordination. And I'm going to have my finger out here, and what I want you to do is starting on this side, touch your nose, and then touch my finger. We're going to do it 5 times on this side, 5 times on this side, okay?
Alright.
Whenever you're ready. 1, 2, 3, 4, 5. Alright, now we're going to do it on this one, okay? 1, 2, 3, 4, 5. Alright, so now the next one I'm going to do is I'm going to be moving your thumb around, okay? So I'm going to either move it up or down, and I'm going to have you close your eyes, and I want you to tell me, is it up or is it down, okay? Alright, ready?
Up. Up. Down. Up.
Good. Alright, now we're going to do it on this one. Are you ready? And down. Okay. Up. Down. Alright. You go ahead and relax. Okay. And now what I'm going to do is I'm going to test the movement of your wrists on both sides and see how that's going, okay? Alright, so what we're going to do is I'm going to do this wrist first. Let's see. Good. Alright. And a little bit more. Same thing on this side. I'm just going to hold this one, okay? Alright. So the next one we're going to do is can I see your arm here? I'm just going to move it like this. Can I have you do this? Alright, so this one I'm going to use this. And kneel down. Okay. And do this. Relax. Okay, so now what we're going to do is, if I can, have you come and sit up on the table and do a little bit more of that, okay? This time on your lower extremities, your legs. See how those are working. All right. So, can I have you lift your leg up off the table for me? Both sides, yep, this one too. Alright. Now can I have you lift it up a little bit? And then don't let me push you down, okay? Good. Same thing on this side, don't let me push you down. Good. Alright. So now can I have you bring your leg out like this? Either one. Yep, good. And then this one. Good. Alright, so now bring it out just a little bit. Don't let me push you in, okay? Good. Same thing on this side. Good. Alright, now can I have you bring your legs in with this? One at a time. That works too, yeah. Alright, so bring it in. Don't let me push you out, okay? Good. And then this one. Alright, good.
Good. I got good strength, right?
Yes, you do. Alright, so now, can I have you bring this knee out like this? Or both, yeah, that works too. Alright, can I have you bring it out about here? And don't, yeah, this chair's loud. Don't let me push you down, okay? Good, now can I have you bring this heel to the back of the table? Good. And bring it back again. Don't let me bring you out, okay? Good. And can I have you bring this one out a little bit? Good. Don't let me push you down. Good. And then can I have you bring it back? Alright, don't let me push you, pull you out, sorry. Good. Alright. And now can I have you bring your ankles up to the ceiling? And can I have you point them down? Good. Can you bring this one up? Don't let me push you down. Good, now bring it down, point your toes. Don't let me pull you out. Good. Same thing on this side. Goes up to the ceiling. And push you down. Good. Point your toes. Don't pull you out. Good. Alright. So now, are you comfortable taking your shirt off for me?
Yeah, that's fine.
Alright. Kiss again. Can I have you go ahead and lay on your, actually, can I take your shoes off for you?
Sure.
Alright. Ooh, I like your socks.
Thanks, your Toy Story.
Buzz Lightyear. Alright. Now can I have you lay on your back? Alright. So this time I'm gonna just see how this arm is moving, okay?
Alrighty.
I'm gonna do that one more time. Alright. Alright, and then I'm just gonna move you through it, so just relax, okay? Alright, now relax. Okay. Okay, and then this one. And the arm, and your arm out like this. Very good. hold your shirt up. Still doing okay?
Yeah.
Alright. Don't fall asleep on me, okay?
I'll try.
That time of day. Alright. I'm just going to push your arm down a little bit, okay? Just go ahead and relax. Alright, good. Alright. Now what I'm going to do is I'm going to test your sensation, okay?
Alright.
And I'm going to use a paper clip. So this is what, it's either going to be this, which is sharp, or this, which is dull, okay?
Alright.
Feel the difference?
Yeah.
Alright. I'm just going to do it in a bunch of different places, okay?
Alright.
Ready?
Mm-hmm. Sharp. Dull. 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 Sharp. 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 Dull. 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 Sharp. Sharp. Dull.
Good. This side.
Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp.
Alright. Now what I'm going to do is I'm just going to check something at your ankles, okay?
Alrighty.
Put this on this one first. Okay. Same thing on this side. Alright. And that is it for that one. So if you want to go ahead and sit back up, put your shirt on. And we'll go ahead and put your shoes back on. Alright, Summer. So now what we're going to do is I'm just going to test your balance. It's going to be kind of a little bit of a long test. It's going to be multiple different ways to test your balance. And we're just going to see how it goes, okay?
Alrighty.
Alright. So before we do that, I'm going to put this back on you. Am I leaning forward? Thank you. Sorry. Let me know if I get it too snug, okay?
Alright.
Does that feel okay?
Yeah, that's good.
Alright. But I want you to stay seated because the first one is going to be stand up. Alright. So, whenever you're ready, I want you to stand up and I want you to try not to use that arm as any support. Just stand up like you normally would. Alright. Alright, good. You can, alright, stay standing. Actually, next what we're going to do is we're going to just stand there for 2 whole minutes.
Alright.
That's a long time.
I can do it.
It's probably easy for you.
I stand a lot. I volunteer at a PT clinic pretty often.
Oh,
so.
really? What do you do there? What do they have you doing?
I just like talk with the patients sometimes. There's a lot of people who had brain injuries similar to me,
cool.
so I just chat with them about life, I guess.
Support, moral support.
Yeah.
Do you get to help any of the therapists with like exercises or anything? Do they let you do that?
Sometimes if it's easy stuff.
Yeah.
But I stand a lot when I'm there, so I got a lot of practice with this.
Yeah, you got some strong legs. How'd you get into that?
Well, I had such a great experience when I was first had my injury, so I figured, if I could give back in any way. So I just kind of looked it up, and they said I can come.
That's awesome. Do something with your time, huh?
Yeah, since I can't play basketball anymore.
I know.
Cards. I used to like to play rummy a lot.
Oh. Yeah, I really want to try to, as we progress throughout treatment, get some card playing in there.
That'd be awesome.
See how we can do with that. Gotta come up with some good ideas for that one.
I'd like that a lot.
Yeah, so then you can get that. So did you play like with friends or?
Cards.
Yeah, sorry.
Yeah, with my friends, and I had a little poker group that I would play with, and we'd have a lot of family card nights.
Oh, that's fun. I love playing cards. Not that great though. All right, we're almost done. We got about 10 more seconds. You're doing great. This one's easy for you.
Oh yeah.
All right. Okay, so the next one is going to just be sitting back down. So I just want to see you sit down. Try not to hold on.
Okay.
Sit down how you normally would. Good. All right. So the next one we're going to do is while you're seated, I want you to sit with your arms folded, or just this one at least in your lap. And can you come up from having your back, like don't let your back rest against the back support? Yep, and we're going to do this one for 2 minutes.
2 minutes, okay.
I know, this one's probably easy for you, but. I like your socks.
Thanks. I really like corgis. Hopefully I can get one day.
Yeah, corgis are cute. They're very long.
Yeah.
I have a wiener dog, so.
It's just a little smaller.
Yep.
The Queen of England has a lot of corgi dogs.
Oh yeah, you're right. Doesn't she have like, how many does she have? Like 10 or something crazy? That might actually be a very
maybe 6. No, I really think she has like 6 at least.
Oh my gosh.
And they're royal dogs, I guess.
Royal dogs. Yes.
I've had big dogs all my life though, so I don't know how much I think I would like a small dog, but big dogs are just fun to play with.
I know. Well, my wiener dog is the only dog I've ever had, so I don't really know, but she is crazy. Alright, we have a little less than a minute. I know this one's easy.
Okay.
Just trying to do most of these so then I can give you a composite score at the end and it'll tell me just a little bit about your balance, see where we are.
Okay. Are they all this easy?
Some of them get a little bit harder, I promise.
Okay.
Yeah, we start easy and then we get a little harder.
Gotcha.
For sure. The next one, I'll have you standing back up, but we'll do that. We have about 20 more seconds.
Some good weather today, huh?
I know.
It's chilly.
So nice outside. I wish I could hang out outside longer, but gotta be in here, you know.
Yeah.
Did you do anything outside today?
I walked to get the mail. That was about it.
Yeah.
That was my glimpse.
All I've done pretty much. Alright, so now what we're gonna do is we're gonna stand back up.
Okay.
Already stand. Yep, good. Okay, so now can I have you put your feet together? All the way together if you can. And try not to hold on, and I'm gonna just see how long you can do this, okay?
Okay.
This one a little bit harder.
Yeah. How long is this one for?
Just seeing how long you can do it.
Okay.
If you feel like you can't anymore, let me know. If you feel like you need to sit, that's fine too.
Okay. My leg's getting tired.
Yeah. If you need to sit, the chair's right behind you, okay? We're gonna try to go for 10 more seconds.
Okay, I can do that.
Alright. Alright, we can go ahead and bring our feet back out to normal, to our stable position. Alright, perfect. So now, I'm gonna just see a little bit of how far you can reach, but we're gonna use this arm, okay? Can you scoot that way just a little bit? Good. Okay, so with this one, I'm gonna hold this out. So can I have you bring your arm out just in front of you like this? Yep, I'm gonna hold this out. And what I'm gonna do is we're gonna have you reach forward, if you can. I'm gonna get a little closer to you, just in case.
Okay.
Can we scoot that way just a little bit?
Yeah, that's fine.
Okay. So arm out. Yep. We're gonna just reach in front of us, and then I'll look at the measurement after you do it. Yep, whenever you're ready. All right, good. You can relax. You can put your arm down. Okay, good. All right. So the next one, what we're gonna do is I'm gonna have you, however you need to do it is fine. I'm gonna have you pick this up off the floor, okay? So however you feel comfortable doing that.
All right.
All right.
There
Good.
we go.
Thank you. All right. And then the next one we have is while you're standing, I just kind of want to see a little bit of your reactive balance of your head, okay? So can you, for me, look over your right shoulder as far as you can? Good. And then over your left shoulder. Good. All right. You can just stand. Okay. Next, this one might be a little tough.
I don't know. I'm doing pretty good.
You are. You're impressing me, all right? We're going to turn in 360 degrees.
Easy.
Easy. All right, let's see it. Whenever you're ready. Easy.
I'm a little dizzy.
You need to sit down here. Okay.
No, it's fine.
All right. Next. I have this rule, so let me sit down.
I'm so sorry. Hello, can I call you back? I'm making a video. Okay, love you. Bye.
Don't even worry. That happens.
Sorry about that. It's
No worries.
my mom, she just loves to keep in touch with me.
Yeah. Moms, you know what they do. All right. So now, what we're going to do is something called tandem stance, okay?
Okay.
So we're going to put one foot in front of the other, and I'm just going to see if you can hold it for 30 seconds. We're going to try. Okay? Whenever you're ready. Yep. Good. Halfway there. Good. You okay?
Yeah.
All right.
Yeah.
I'm right here, so don't worry. You got about 5 more seconds. All right, you can bring your feet back out. Okay. And then the last one we're gonna do, and I know this one might be difficult, okay? You don't believe me, huh? All right, we're gonna stand on one leg. Then we're gonna switch to your other leg. We're gonna try both, okay? And what I want you to do is just try not to hold on. We're just gonna see how long you can go. We're gonna try to get longer than 10 seconds.
Oh, okay.
Okay?
I didn't have to do that.
All right. All right, you can put that one down. Okay? And we're gonna stand just on our left leg, okay? And I got you. Yep. Okay, you can go ahead and relax.
Okay.
All right. So, we are done with that for now, okay?
Alright.
All right, so now what we're gonna do is I'm gonna watch you just walk, okay? So, what I want you to do is I want you to get up from the chair, walk around that bottle over there, come back and sit down, okay? And I'm just gonna time you. See how long it takes you. So, whenever you're ready.
Alright.
Ready, set, go. Come over and sit down. All right. All right, Summer. So we are done for today. Okay? Do you have any questions for me or anything?
I guess just, do you know how many times a week I should be coming to see you?
Yeah, we're probably going to start with around 2 to 3 times a week if that fits in your schedule, because I know you're volunteering a lot and stuff like that.
Okay.
So, but what we'll do with that is when you go up to the front desk and talk to them, they'll schedule it all out for you. They'll schedule a few weeks out in advance with whatever works with your schedule, okay? But I would like to see you probably 2 to 3 times a week.
Okay,
if
cool.
that's okay. All right, well, anything else?
You think my test went good today? Think I can maybe play cards again?
I did, and I really would like to implement that into your therapy. So if there's anything else that you like to do that you want me to also implement, I know basketball, I know cards. Think about it. Next time you come, we can talk about it, and we'll go from there, okay?
Awesome. Sounds great.
All right, well, it was nice meeting you.
You too,
Look
Dr.
forward-
Sarah.
Thank you. I look forward to seeing you next time, okay?
All right.
All right.